As more and more people get vaccinated, Colorado is seeing a huge jump in cases among one specific group. CBS4 Medical Editor Dr. Dave Naida is here now. And Dr. Dave, there's been an increase in cases among children. Why are we seeing this jump, and what can parents do to protect their kids?
Well, I think when you take a look at the fact that kids are seeing an increasing number of cases, you look at the fact that children are the number one unvaccinated group in Colorado. So that obviously plays into that. And then you take a look at the other fact that the circulating strains in our state are generally mutated or variant strains, and they are much more contagious. So it does add up to a formula of increased cases in children. Now, in terms of, what really can parents do here? I think first off, you look at schools, and schools are not exactly, these centers for virus transmission. It really is more of an out of school type of situation where you need to be concerned as a parent. Extracurricular activities, what's going on there? What about kids who are gathering together outside of a school setting? How are they doing in terms of masking and social distancing and so forth? And that's not something that typically would happen in a group of school-age kids. And then as a parent, you need to kind of take a look at your own behaviors. How are you doing? Are you vaccinated? Are you practicing good social behaviors when it comes to COVID? So I think if you kind of take a look at that big picture there are some things that you definitely can do to help your kids out, protect your kids, protect yourself. And I think that as we go towards summer, things will definitely look much better when it comes to this situation.
Great advice there. And a couple of weeks ago, most Colorado universities had no plans to require vaccines for students and staff. And now they're changing their tune. Both CSU and CU announced they're requiring the shots. Why do you think that is?
Well, when you take a look at how COVID has been over the course of the past year, if there's one thing that is common about it is the fact that it's uncommon. We keep on changing guidelines and restrictions and how we take care of things. And so I think it's just natural that colleges and universities evolve as well. And I think it has to do with a couple of things. Number one, we now have really a surplus of vaccinations that are available to a college group of people. So I think that we are going to be able to get vaccines to college and university students. And then you take a look at that population itself. I mean, it is a population that generally tends to be more congregate living, close quarters in terms of what takes place within a classroom or lecture area. You also take a look at the mobility of that population. It's campus, off campus, and then out into the community. So those are some very important factors. So it's important to recognize too that, when we look at college students, we typically think, well, we're looking at 18 to 21. But in many universities, the number of students who are within that age group is actually about half. About half of students are over the age of 24. So you really do have a fairly wide range of student age groups there. I think the other question boils down to, can universities and colleges actually mandate vaccine use? And the answer is definitely yes. I mean, we do it for measles, mumps, rubella vaccine. We also do it for meningitis vaccine. So it's something that definitely is doable, and colleges certainly can get on the COVID vaccination train.
Yeah, that definitely caused a lot of conversation when both of those universities announced it on the same day. The state epidemiologist says that herd immunity is weeks, if not months away. When do you think we'll reach herd immunity?
I think this is a good news, bad news sort of deal. I think the bad news part of it is just within the last week, we have been hearing more and more discussion among experts in public health and epidemiology and infectious disease saying, our country may never reach true herd immunity. We may have problems where COVID becomes something that is something we really are going to be controlling, not eradicating. And the reason for that is, number one, variants, but number two, people not getting vaccinated. I think when you take a look at things that point to the numbers of people who are vaccine hesitant or just plain vaccine refusal, that is really what is going to enable COVID to be with us. It'll almost become, we think, maybe an influenza or flu-like situation where there is some seasonal variability year to year. There may be need for a booster vaccination. And so that may be the situation when it comes to herd immunity. I think when you look at Colorado, it is a little bit more of a good news situation because our state really does a great job. We use the vaccinations that are allocated to us. The majority of Coloradans do want to get vaccinated. So that's really great news, especially when you compare us to other states. There are some other areas where half of people, or 3 out of 4 even, in some pockets of the country are just refusing to be vaccinated. And that really is a big problem for us. So I think in terms of what we can look forward to here in Colorado, if we can keep up our rate of vaccinations, that really is the magic formula. It is 3 things. It's vaccinate, vaccinate, vaccinate. If we are hoping to get to someplace maybe in midsummer where we can get back to some sense of normalcy.
Wonderful. Well, thank you so much for joining us with all this important information. We always learn so much talking to you, Dr. Dave. And we'll talk to you again next Monday at 11 a.m. to get more coronavirus and vaccine questions answered. We'll be right back.